So during a septorhinoplasty, well, just before it, we'll re-look at all your photos and go over a surgical plan. Then during the septorhinoplasty, depending on the plan we've chosen, so whether that would be in common terms an open approach or a closed approach, we would look inside the nose and correct the areas we're looking to correct. So whether that is the nasal septum, straightening the nose, or changing the shape of the nose for the cosmetic septorhinoplasties, where you're looking for a certain look at the end of surgery. At the end of the surgery, you would be recovering. Most of my operations are done as day case procedures. And then we'd look after you from the hospital and go over your post-recovery advice. Most people, as I said, would be going home. You'll go home with a dressing on the top of your nose, including a plastic splint. You'll have tape on your nose, and that will stay on there for a week until I follow you up 1 week after your first surgery, and then we'll discuss again about your aftercare. So the recovery times can be variable, but in my experience with my patients, most people have a little bit of pain. A lot of people can be very comfortable, and the pain tends to come down after a few days. At about 7 days, when you come back to see me, we take the tapes off and the splint off your nose. There can be some bruising around the eyes if we've had to fracture and reshape the nasal bones. Your nose will feel a little bit blocked, and that can last for a few weeks. I always say most of the swelling comes out of the nose by about a month. 50% of the swelling after about 3 months, but the last part of the swelling in the final nasal look, myself and most nasal surgeons will say, is by about a year. So the medicines you'll be given depends on the approach. If you've had an open approach, you'll have some little stitches just in front of the nose. We'll give you an antibiotic cream to apply to those stitches twice a day. You'll also be given regular painkillers and also a salty water spray to spray inside your nose to help clear the crusts and the blood clots that can form. That's the only medicine really you'll need for the first 7 days. After that, some people can use painkillers if they need it. Some people might want to use homeopathic medicines such as arnica for swelling, but in the main, I would advise ice on the top of the nose as and when you need it. So this is a really important question. For the first few days after the surgery, I would say do as little as possible. You can sleep as you normally want to. You don't necessarily have to sleep upright because that's actually quite hard to do, but during the day, no bending over, no exertion. So that's really important for the first 7 days. A lot of people can get back to remote working after a few days, but always give yourselves a bit of a break. You can get back to work after 7 days if you wanted to. A lot of people take 2 weeks off. But once we remove the splints, the advice I would give you there specifically, we use things such as nasal massage. And nasal massage, you massage from the middle of your nose down to the side, and that just helps promote blood flow and drainage and decrease of swelling from the nose. The other thing I advise people is nasal taping, and I'll teach you how to do that. And that's using things like steri-strips or micropore tape, which you put on the nose, and you can do that every night, not during the day, but every night for up to about a month, and that can help take swelling down and just enhance the skin shape. And we can also, if it's about the tip, we can help just promote where the tip comes into position with nasal taping. After that is just live life as easy as you possibly can. I would always say avoid alcohol and please don't smoke. So follow-up care, I will see you at a week after the surgery. But obviously, if there's any issues, you can contact us, and we would see you at any time after your surgery up to that first week. And then a further follow-up is given 3 to 4 months after your first, after the surgery, to see how you're doing. Yeah, so with any surgery, complications can occur, and we would go through that specific to yourself in your needs and the surgery that you're having. The common complications with any septorhinoplasties are nosebleeds. Infections are very rare actually, but you can get a nosebleed in an infection in the septum, very rarely, called a septal abscess. The other complications can occur if we're having to straighten the septum. You can get a change in the nasal shape that you don't like. So that can happen with any rhinoplasty. You can get a hole through the nasal septum called a septal perforation. A lot of people can get numbness of the top teeth and gums, which is temporary. And those are the main complications. The other thing with rhinoplasty, which is important to know, is that whilst we can do photo modeling on your nose, it's how your nose heals and how it scars in. So the main complication with septorhinoplasty is that the nose doesn't look quite like how you wanted it to look, but the vast majority of people get a really good result. And the last important thing is, if you need a nasal revision, I would always advise that we wait a year.